My name is Christiana Johnson, and I'm a third-year medical student at the University of Minnesota Medical School. I had the honor and privilege of being a Twin Cities Medical Society Public Health Advocacy Fellow this past year. I'm really excited today to have the opportunity to speak with Yi Yang, who is the owner of Caring Solution Services, and Esther Brown, the Women's Health Coordinator at Bhutanese Community Organization of Minnesota. We're going to be talking about cervical cancer screening, particularly among Southeast Asian women, as part of the Twin Cities Medical Society's Community Conversation Series. A big welcome to Esther and Yi. I'd love to have both of you introduce yourselves and share a little bit about the outreach going on in your communities to address cervical cancer and your roles in this outreach.
So, hello, my name is Esther Brown, and I am working with the Bhutanese community organization. And my role in this community is a women health coordinator, and also a little bit of providing the community service, just like interpretation, navigation, system navigation, interpretation, and providing resources and connecting them with the right resources, something like that.
So my name is Yi Yang. I have been working with Lao Center for a couple years now, probably like 4 years or a little more, with a project here and there. And also have been really involved in the community. I mean, really involved in like organization or event, and I've been, have a display table at the event, like tournament, or we happen to make a community event. In the area of cervical cancer, I know I haven't, because due to the COVID hit, I haven't displayed a table at an event to specifically talk about cervical cancer. But I heard, and I know by working with the community, it is like Esther was saying, it's something that people don't want to talk about it. But I mean, I guess I have been working with the community for a long time. I would say more than 15 years, close to 20 years in the area of working with women and students. My background is mostly K-12. Now that I have, since I started working with Lao Center and started creating my company, I have been working more with the adult now too.
So what do you think some communities like Hmong and Bhutanese women, what do you think that they think about cervical cancer screening, and if there might be any hesitancies around that?
Yes, that's lots of hesitancy. It depends on the individual. But from my experience working with them for over the past 2 years, I have learned a lot. So yes, that the people in my community, they are like I don't want to quite use the word like hers, like illiterate, but I don't know any other word besides. So I believe due to the lack of literacy, and because of that, our people in my community, they are not very aware of their personal health, and so they just most of the women in my community, most of the women are illiterate, and only few women are literate. So the literate women they are aware of that is cervical cancer, and the people get cervical cancer and people die from that. And then so but the women who are not literate, they are very busy providing their time and their everything, their self for their family, and that's what they think they are born to serve. And in that in that belief, they are so tuned, sometimes even though they do experience something like going on in their body, they don't feel good, but they always don't prioritize their comfort, their health, because they never think about their health. They think about all the time their children, and their children comes first, and then husband, and then extended family, just like father-in-law, mother-in-law, in-laws. So that's how like our culture, like practices has been around many years. So some of the people, some of the women, they still have not come out of there because of that again, the family orientation, their background, and then so they stick with that, and as long as they get to serve their family, they are good. And even though sometimes they feel and they say, well, I really don't have a time to go and get a screen or something like that. And moreover, the other thing is like they just the women in the in my community, they are like, especially Asian. I don't want to overgeneralize, but Asian, especially Bhutanese, I can stand for my community, so the women, they are like, even though they want to go to screen, and because of the lack of communication, they don't have access to the communication, and then they have to rely on somebody, and they have to express everything. They can't just go directly to the doctor and express themselves. They have to go through somebody, around somebody, and then which is they there is a kind of problem of trust, and they don't want to share. They don't want to go and tell their problem to somebody and reveal everything. And then that's one of the things I see, the great stumbling block from the gate, for the women to go and get this screen.
I think those are all really important things to talk about. I think what I'm hearing is there are barriers to information access. There's a culture of having a hard time prioritizing personal health. And then there's trust and establishing trust in the medical system itself, as well as in individual providers. And I think those are all really important barriers, actually, that you touched on really, really beautifully.
There are lots of things I can explain, but the thing is, sometimes I can't come up with the right terminology and languages, so that's my barrier, from on my end. And then but there are lots I have seen and experienced, witnessed, so much more. But there's lots of limitation.
I see that we have, I call them like on the generation hat. Like we have the first generation, second and third, and I found that like in my sister generation, like first or the second or third generation, probably they are in their mid 20s or 30 right now. They are not that hesitant. They grew up this country. They learn at school. They're not as much as hesitant as going to the doctor. My age is, but I know that like the elder, like my parents' age, either 50 or 40, 50, it's harder to talk to them. You talk to them, then they're hesitant to, even like right now when I talk to some of the women, they would say, no, I don't want to find out. I don't want to know. Even though the doctors say, well, let's go check it out. Or even though they found something, then they say, no, I don't want to know. So yes, you have a different gap of generation, or the people that some of them say, yes, I want to check out. And some people say, nope, I don't want to check out. And some people will just say, they just want to tell you what you want to hear. They just say, oh, yep, I did. I checked out already. But I know that they haven't. Because of, you hear from friends or cousins, especially those sort of women that relative. So, have a really different point of view. But yes, I think that right now we still have women that are nervous or that don't want to get screened.
Mm-hmm. So what have you been doing to kind of overcome these barriers and encourage women as well as the general population, because the HPV vaccine too applies to everybody of all genders. So what have you been doing to encourage screening and vaccination?
I didn't have experience in the past working, with the community. I had passion, and I did work with the church people and the young people and the children like that. And then so that just kind of gave me a little, confidence to work with them, but still I was kind of not, very, very like, super confident working with them. But, as time go, as time left, that I started learning the better strategy and approach, how to get the women and convince them, or get how to get them to go and get a screen, and how to, so. But my, one of the way that how I do means I noticed that, like a cervical cancer is like a, the cancer that's we're gonna find in a very personal, private area. And then so, and and people, and in my, especially, my I mean my culture, they are very sensitive to this kinds of, personal thing. In like a regular basis, we don't even talk about, even talking about those kinds of thing is shame. And like and we are, we go against our tradition. And the women who speaks, who brings up those kinds of conversation, the community is not, what do you call that, not relevant to lots of other. And it's kind of, and you're gonna stand out, or kind of weird person when you talk about those kinds of stuff. But that's one of the reason the people, they don't talk even though they have the problem. But what I noticed means, once I started, since I already have a little experience of working with the young people, and I started working, I started, I was, what do you call that, considering the approach that is kind of, what do you call that, that fits, or that's relevant to where they are at, in their life. And then so, and then, first of all, I noticed that building the relationship with them is the key in like outreach, any kinds of outreach, project work or any work. So with that relationship, the women are not going to come and just share with you everything that's very personal. And then the relationship, and once you, and then first of all, I don't just jump right into the conversation that's very uncomfortable to them. And I just, first of all, I try to just start off with very, very, normal or very casual kind of talking conversation, and just getting to know them and asking their, their everyday life, and just, and yeah, that's a very, I start off that way. And then little by little, and I kind of was them as we have, and having conversation, I was them. And I was there feeling, and I sense if the people are ready, if the people are open, if the people, you can tell, And so if I see the people are even the at the first time, the people are comfortable to talk those kinds of stuff, and I go ahead and then start talking about our topic, like what are we going to talk about, our project, cervical cancer. And but if I notice that the women is not ready, and she's just if she's still kind of reserved, or kind of type of person, and I kind of leave that person there, and I go next time and we follow up with that person, and then again try to kind of check with her where she is, if she's gonna be open this time, if she's gonna, and so, and that gives me to open the door for me to build up relationship with them. And after following up like a couple times, some people are pretty, start getting pretty open and then becoming friends. Some people is kind of harder even after a couple times. And that's, I don't give up. I keep on, I'm very persistent to follow up with that person. And then so after building up the relationship, and then I don't even have to convince them. I just start conversation, and then it's like, oh, where, and they start asking, they kind of show interest, and oh, you know what? Actually, and that's a kind of very something like first time they don't even talk, they don't even mention that they have problem. But after talking to them like more than a couple time, multiple time, and they started, just I don't even have to ask them if they have problem. They just start opening up, where to get, yeah, I'm experiencing this many years, So I wanted, I'm interested. So yeah, and that's what I wanted, and then that's how, that's how my approach looks like. This is how I do things. And thereafter we build up the trust, and then we have each other, and then thereafter, and then once I get one person, it's like a, like a when sometimes we are too overwhelmed and too like professional, want to go, by the professional way, and then try to just, get the thing done one time, or like that. But I don't see in my, and I don't see that's very effective. So just give them the time to think. First of all, just talk to them and give them something to think about it, and next time, and follow up with them. And then and then that's how we build up the trust, and we become friends to each other. And then I don't have to even go around so many women and get, so many women at one time. Once I know one person very well, and that person is very helpful to me, that person is like connecting with the other, and they have their friend which I don't know, which I'm not, in contact with, and that person start communicating with their best friend, and that best friend has their best friend, and then that's how I have been getting, the women to come to, screening.
That's pretty amazing, that ripple effect that you're having through relationship building. I commend you.
Yeah. And sometimes I go like not only that, sometimes like I just, I help them with the need they have. I don't jump right into. If I kind of sense like a little, like they are kind of resistive, or they are hesitant to the topic or to talk about, and I leave them right there, and then I started working different angle, and like whatever need they have, whatever, like how can I give my best to them, and just being friend or being help in different area. And thereafter it's like so easy. And then yeah. And but sometimes if you don't have time, if that person you don't find or meet in daily basis, and you only have very so much time to meet that person, talk with that person, you just give them just a basic tips, and just like the tips and some suggestion also. And you don't have to convince them, but because convincing is, I don't feel myself comfortable to convince somebody, because we don't know what they go through, and sometimes people, when we start convincing, they get annoyed. That's what I have noticed. And then, again, it depends on the individual though. And but some people are so open fast, they are so quickly, they want, oh yeah, I want to go. But some are not that way. So we need to see where the people are at, who they are, and then thereafter, and we just consider that the approach that's relevant to their life situation.
I like to go to one of the Hmong radio station, which I work with them, and I can go there like every week or once a month. So I have done more like education. Mostly, I found that work most is one-on-one, because I can go to the radio station and talk about cervical, talk about mammogram, talk about that thing, but then it's better where I meet people, because I am a very outgoing person that when I go to places, a funeral home or event, I will just say, hey, by the way, I'm working with this project, and this project is to encourage women to get screened, and then whether mammogram or PETs or the vaccine, and then you talk to them one-on-one, and you offer the help to say, I can schedule if you're interested. I think a lot of time if we go to like a radio station or YouTube, and yes, you probably have 300 views, but then they have to take the effort to call you and then find your phone number and call you. But if you meet with them one-on-one, you have the number and you follow up with them, and you connect them. So I'd say my most successful outreach is the one-on-one, going through a true event.
I hear from both of you that you are such leaders in your community through this sometimes challenging but very rewarding relationship building process. Are there any stories that stick with you that you'd like to share with everyone?
Right now, as far as because of COVID, as far as getting women to get the PEP, it's harder. But I think my story is that for the mammogram, I have worked with some women that they never, even though they're in the 40s, they haven't done any of the mammogram screening. So to get them to go there, I think to me is something that I feel like we have done something that really influenced them to go to check up. Because if we would not have this program, which the PAP screening is something that I want to hopefully everybody get vaccinated, and then people feel comfortable going to the doctor, then we want to do more of that. But I think to me, the real story is that to get women that never done it before to say, yes, I'm willing to go. Yes, I agree with what you said, and maybe I should check that out. I should go check out. So I think that's just not one story, just one story, but I have other negative story where and I know a couple women that they have found out that they had cervical cancer, and then it's too late. And then you will say, I want to do an interview like what we did here, but they said, no, I don't want to be shown and I don't want to talk about it. But if they have told me it's too late, they should have gone to the doctor. They should have checked it out. And so I know one that just passed away on November of 2020, that she has a cancer, breast cancer, and she passed away. And the last time I spoke to her, she was like, yeah, I wish I had gone to the doctor. I wish I would, even my husband told me not to go because don't trust this country, the Western medical doctor, and I believe my husband, and now it's too late, so she passed away. I think that's not a successful story, but it's a story that I would say I wish she was willing to talk to other women. But I think this story, when I go to places, I share this story, and it really hit some of the women that is, I don't want to go check out.
Yeah, thank you so much for sharing. Esther, anything you'd like to add, or story that you'd like to share?
Yeah, I would like to follow up with the first question you asked me.
Yeah,
I know this is what I do is like as I started talking, then it's kind of it started like dripping, but at the first time I kind of get like frozen, it doesn't want to come out, but anyway, yeah. And then there's in our community, one of the things that's kind of a very sneaky kind of thing, like the women, that's one of the barrier for the women to go and get screened is kind of their mental health and their emotional health situation. Like if they don't have anything like any stamina or any type of if their steam is so low, if they they already have a lot of multiple the health problem in their life, and they have already lost the hope that they will not do well, or it's too late, and the condition of where they are at their mental health, their mental health, because if you are not healthy emotionally and mentally, if you don't have that drive, or that you don't love yourself, because all the community, how they label you or identify you because you are not worthwhile or something, from even family member, extended family member kind of already label them, and they they have lost themselves, they have forgotten which is I call like forgotten self, because they they get busier doing taking care of other people, and they and then mentally they are so wired already negatively, and they don't even think positive about themselves, and they don't have self-love. And so when they don't love themselves, and why to go to doctor, why to why to take care of ourselves? That's the thing, very underlining. Underlying. It's not apparent. It's not very, explicit or what open to people. But when I see, I see sometimes very, I don't know how to explain. It's like my inner eye, and then when I see that, as I'm talking to the women, they are depressed. They no longer want to go to doctor. They are already there, but they do have lots of problem, and they already overlook themselves, and they don't even know their values, who they are, and how much worthwhile they are. They even don't know, because of they learn that, or they are in that situation because sometimes from our own intimate partner we are just put down like that, or society, community, or there's so many other factors. And then so mental health, when people are just not right in their mind, they don't pursue to take care of, and they don't pursue their health. They don't want to be healthy, they don't want to go to doctor, they don't want to follow, they have nothing to do with themselves. That's what I wanted. They don't have anything to do with themselves. They are forgot themselves, and they are not there for themselves. They are there because of their mental health, emotional health. They are already down. They feel no longer they are important for themselves. So that's one very underlying, very kind of unnoticed type of factor I just learned or saw in the women in our community.
Yeah, and I really appreciate you sharing that. It's I think a good reminder for me as someone who will be a future provider is kind of thinking about things more holistically. And I wouldn't have known before this conversation the role that mental health is playing in this. So thank you.
I would like to emphasize and talk more about mental health. Like we talked about all kinds of physical health, right? But the people are deteriorating inside, and they don't want to take care of any sort outside, And so mental health is very important. And every people I can't talk and anything, sometimes people might get annoyed by me because I keep on talking those concepts, because I see how important. I see the mind occupies the almost most important part of our life is our body. Our whole being is the mind, and if the mind is not right, then people, they don't get motivated to go and take care of themselves.
Well, our final question for you both is, we'll be sharing this conversation with physicians and medical students across Minnesota, and we'd love to hear what physicians, medical students, and any healthcare professionals can do to support your work.
I think like Esther was saying earlier, is there more of their building the relationship. I know that if people know me, they know me, they know that they can talk to, then they'll come. That's what I'm asking the students and professors to help us with. It's just pretty much just go out there and also talk about their work too, not as like talking about our work, but they talk about their work. Create for a doctor sometime when they come in and they have a bad, it won't return. So if we do our work in the community, recruiting, telling women to come in and get checked up and that, but if they come in and you don't smile, you don't welcome them, you don't talk to them nicely, like treat them well, one bad experience can ruin their trust of coming back. And like I mentioned earlier, we haven't done much on the PAP or the cervical, but we had done the mammogram, and some of the women I talked to, they said, no, I'm not going back. My first time there, it hurt so bad that it was like a couple of days. So, one bad experience can make the patient feel I don't want to go back. So just be, once we in the community, once we able to recruit and tell them to come check out. So we just ask you guys to be, polite or nice and welcoming, warm, and just so I think that's pretty much what I have if we are able to recruit. Other than that, maybe we can do more of the visual. I mean, like create more visual flyer, more audio that we can pass it out. I know we have some already, but maybe we can do more of more in different languages so that we can display, or we can put in the more, I would say the more the better. So we can do one-on-one marketing, recruiting, we can go radio station, we can do more. What I haven't seen in the Hmong community is the educational radio. Like I haven't seen someone will go in and have an advertisement about why is it like 5 minutes, or no, I would say like 30 seconds, and say why going to checkup is important. So I want to see more of the getting a quick why it's important to go on the radio or TV or more of that. So
I love those ideas. Yeah, go ahead, Esther.
As you was, telling that, relationship, that's again most important. I totally agree with you, because I know the doctor don't have time to, establish a relationship with each and every patient they come, and I know they have their own, their life. But again, they have to. I believe the doctor, some of the doctor, they are very tight because of their time, because of their whatever they are going through in their life. But again, like you can't tie your personal life to your work, and you need to think you are dealing with a human who has soul, and not only just be a mere, human, just like a professional way. If you only see the people or treat the people in a professional way all the time, yeah, that's a good part. You have to be professional. But sometimes it depends on the individual where they come from. Sometimes the professionalism, practicing professionalism, it might not be very effective to reach out the community, especially like an Asian community who we are very like you know we came from like we already have a trauma and stigma from the past experience, like where we are in refugee camp, the people treated them very straight, and like very badly. And then people, people is still carrying that trauma and walking around, and when they go to doctor, I believe that doctor needs to remember that they are not only mere doctor to them. They are kind of like a, if I have to say, in like a in Hindu religion, we call sometimes, like people call, if the people are so nice, they call God. And some of the people, some of the patients, they don't have a very good relationship with the family member. Family member, they don't listen to them. Family member, they don't have anywhere to pour out their emotion, their feeling, their burden, what they carry around, and which is very, not good for their health. And then so when they see the doctor, they kind of feel like they are meeting with somebody. They're very, very important. It's just like a father, parent, mother, like God. Sometimes even people, I have heard people saying that doctor is second to God, because but doctor work with the health, and they are the one who save your life. And then so that I believe the doctors to remember is like they have to be ready or able to be flexible according to the people where they are. Again, that this is my favorite saying, because it's very important to sometimes we have to bend. I always say, I always, use this expression in my work, like I have learned, if you want to help the people, if you want to support truly support, if that work is your passion, want to help people, support people, you have to be able to bend down to lift that person who are fallen. But if the doctor does not just, is not willing to spend a little extra time with the patient to listen to them. Sometimes even listening to the doctor, if they listen to the everything what the patient has to say, maybe not everything, but still some of the thing patient has to say, they at least they release some of their problem, and they go home well, and they don't even need a lots of treatment. I mean, lots of deeper treatment. But sometimes doctor have to do according to the problem the people have. But the doctor, I believe it's very important for the doctor to see the patient different perspective, and they need to, I believe, and it's very important for them to understand their cultural, their family orientation also, and then where they come from. And if they ask, if they spend, just a couple of minutes, a second with the patient, asking them, what they feel and their feeling about today, I believe that would add much flavor to their job, and it will be, and they will understand how to work with the people, and they will be very influential doctor person in people's life. And not only doctor, they will be treated more than that, and not only doctors. So yeah.
Thank you so much. And I really liked what you said kind of about the like bending down and meeting people where they're at and being flexible in that relationship capacity. I've learned so much from my discussion with both of you, and I know many others will have takeaways as well. I want to thank you so much for your time and for your dedication to these efforts. I commend you both, and you both inspire me, so thank you.